In today's Health Watch, the norovirus, commonly known as the stomach flu, is on the rise as the holidays approach. The highly contagious virus spreads through contaminated surfaces, food and water. CBS News medical contributor Dr. Céline Gounder is editor-at-large for public health at KFF Health News. Good morning. Health officials say that this highly contagious norovirus strain is behind the rise in these cases. So what more can you tell us about it?
So we're seeing a new strain circulating, and every time you have a new strain, whether it's norovirus or the flu or COVID, people don't have as much immunity to it, and so you're going to see more cases as a result. What we are seeing is this norovirus season started a little earlier than usual, but November to April is usually norovirus season. And big picture, we think it's going to be a fairly average season.
Symptoms, and why do you think the risk is so high now?
So symptoms include diarrhea, nausea, vomiting, but what we really worry about are symptoms of dehydration. So might be less urination, darker urine. In infants, you're not seeing as many wet diapers. But some other warning signs to look for, especially in infants, would be sunken eyes, decreased tears, and things like irritability or being less active.
Are infants especially at risk? You mentioned that.
Infants are, but also the elderly, as well as people who are immunocompromised.
So I know you're going to say this, but what can people do to protect themselves? I mean, I just came in, I'm constantly washing my hands. Is that rule number one and perhaps the only rule?
Well, we all learned the most important rules in kindergarten, washing your hands. Right? So that is important, but it's not just hand sanitizer. For norovirus, you really do need to use soap and water. If you've been sick, you should be staying home for at least 2 days after your symptoms improve, and don't be preparing food for other people until 2 days after your symptoms improve.
We got the news yesterday that the federal funds are going to be cut to the American Academy of Pediatrics. They're clearly very upset about that. Why do you think that's happening, and what exactly does it mean?
Yeah, what we're hearing is that HHS is citing identity-based language, so racial disparities. And we do know there are racial disparities in a number of different issues. For example, rural kids and their access to health care, access to early autism and hearing screening, which are some of the programs that are being cut here. Others include fetal alcohol disorder prevention programs, teen mental health programs, and programs to prevent SIDS, sudden infant death syndrome. So how do you ensure safe sleep for infants?
But you said racial disparity, they don't like the language that's being used? I don't follow. What do you mean?
Yeah, just even saying that or acknowledging that there are racial-related disparities is a controversial thing right now.
All right, Dr.
It's also a reality, though.
Yeah.
It is a reality.
Thank you so much.